Hello, my name is Jill Nyland, and I will be discussing global health. I will be focusing on global cardiovascular disease and cancer health prevention. The objective of this presentation is the National Academies of Science, Engineering, Medicine Global Recommendations, the vulnerable population, current healthcare policies, the reason why I selected these subjects, and reason for implementation. Global recommendations. Risk factors for cardiac vascular disease, CVD, should be targeted. Hypertension and cervical cancer should be detected and treated early. Vaccinate against diseases that are prevented by vaccines. The National Academies of Science, Engineering, Medicine, 2017. Cardiovascular disease, CVD, in the vulnerable population. The vulnerable population of cardiovascular disease consists of several problems. According to DeHert 2018, the relationship discovered correlations between coronary heart disease and mental disease during decades of investigation. Caceres et al. 2018 stated that several risk factors are elevated in men identified as bisexual. There is a need for cardiovascular disease and mental health screenings, especially in bisexual identified men. While accurately estimating risk among Asian Americans is difficult, smoking is an exceptionally high coronary vascular disease risk factor among specific Asian ethnicities. Salt sensitivity, BMI, and resistant and refractory hypertension contribute to disparities in blood pressures in African Americans. Socioeconomic status can cause people to be more vulnerable due to the inability to pay for healthier food, decreased education, failure to make it to the doctor due to poor, unaffordable health care. There are also risks of not being able to afford medication. Women have a lower rate of coronary vascular disease than men, and clinical data has shown that women have a greater rate of mortality and a worse prognosis following an acute cardiac event. Geographic location can make it challenging to make it to the doctor, and medical access in rural areas may not always be available. Disabled people also may have a difficult time making it to the doctor with physical inabilities. Center for Disease Control Prevention, 2014. According to the Center for Disease Control, the risk factors for cardiac vascular disease are blood pressure that is too high, unhealthy cholesterol levels in the blood, diabetes mellitus, obesity, and a diet high in saturated fat, trans fat, and cholesterol. Some more risk factors, according to the Center for Disease Control, are lacking sufficient physical activity, consuming an excessive amount of alcohol, tobacco consumption, and genetic factors. Primary guidelines, cardiac vascular disease. According to ART, some of the primary guidelines are to encourage your patient to have a healthy lifestyle throughout the rest of one's life. Assess the health-related social detriments. Adults between the ages of 40 and 75 who are being evaluated to prevent cardiovascular disease should have their 10-year atherosclerotic cardiovascular disease risk estimated. Some more primary cardiac vascular disease guidelines are: a healthy diet should be followed by all adults. Adults should do at least 150 minutes of physical activity every week. Adults with type 2 diabetes should improve their eating habits and exercise according to the guidelines. Tobacco users should be helped and forcefully advised to quit. Arnott, 2019. last primary guideline, cardiac vascular disease slide, also stated by Arndt, is that because of the absence of net benefit, aspirin should only be taken infrequently in the routine primary prevention of atherosclerotic cardiovascular disease. All adults with hypertension should consider non-pharmacological therapy, and statin medications is the first-line treatment for primary prevention of atherosclerotic cardiovascular disease. Current policies and guidelines for cardiovascular disease. According to Flack and Atcola, 2019, hypertension is diagnosed when blood pressure is continuously between 130 and 80 mmHg. Treatment is started when blood pressure is over 130/80 continuously and patients are over 65 with comorbidities. Some more guidelines according to Flock and Atcola 2019 are that when blood pressure is over 140/90 mmHg, non-high-risk people will begin taking medication. In most cases, the target blood pressure is less than 130/80 mmHg. Now we are going to discuss human papillomavirus vulnerability. Human papillomavirus HPV positive women were more prevalent in Black and Hispanic women. Center for Disease Control and Prevention, 2020. Individuals who are immune compromised, such as pregnant women, are more susceptible to infections. Carr, 2016. Human papillomavirus at-risk population. Adolescents and young adults between the ages of 15 and 25. Immune compromised young women. Women over 55 years old who are immune compromised. And women with a sexual history. Some more at-risk human papillomavirus situations are infection with specific high-risk HPV strains for a long time, immunosuppression and human immunodeficiency virus infection, and the co-occurrence of other sexually transmitted illnesses are known or postulated physiologically based risk factors. Current policies and guidelines for HPV. The HPV vaccination program in the United States continues to focus on adolescents. HPV vaccination is most effective when administered prior to any HPV exposure. There is a catch-up period that is harmonized across genders until the age of 26. Markowitz, 2019. The more current policies and guidelines for HPV are to make the immunization schedules easier to follow and may be more practical to apply. Most adults over the age of 26 do not require HPV vaccines, according to the providers. The CDC does not actively promote immunizations among individuals over the age of 26. Selection of global health recommendations. I chose these global CVD recommendations because in the United States, heart disease is the top cause of mortality for men, women, and people of most racial and ethnic groups. Center for Disease Control and Prevention, 2021. Understanding the difference in CVD risk factors can aid in developing cultural sensitive interventions, prevention programs that help vulnerable populations. Center for Disease Control, no date. Selection of global health recommendations for human papillomavirus. The reason why I chose HPV along with CVD is that the most prevalent sexual transmitted infection is HPV. HPV infection has been linked to hypertension, premature birth, and low birth weight. Because their immune systems are reduced during pregnancy, women are more susceptible to infections such as HPV. The HPV vaccinations can prevent HPV. Funding for global health goals. Funding and preventing cardiovascular disease and human papillomavirus are vital decisions to improve the population's health and well-being while saving health care finances. According to the projections, the total direct expenditure of high blood pressure might reach $220.9 billion by 2035. American Heart Association, no date. Stroke is one of the primary causes of long-term impairment. More than half of the stroke survivors aged 65 and up lose mobility due to their stroke. Center for Disease Control, 2021. Funding for global health for human papillomavirus is just as important of a vital decision to improve patients' well-being and health while saving finances with prevention. According to the CDC, cervical cancer affects over 12,000 women in the United States each year. More than 4,000 women die from cervical cancer despite screening and treatment. For patients younger than 65 years, the average cost of cervical cancer during their final years of life might be as high as $118,000. For older adults over 65 years, it could be as high as $79,000. Center for Disease Control and Prevention, 2021.